a lot of these patients that come in to see me, you get a diagnosis of sleep apnea, for multiple reasons. Insurance purposes, require it oftentimes before you do any kind of surgery. But also, for a lot of these patients, CPAP is still the most effective option. So most effective, least amount of risk. The issue obviously is that about 50% of people can't tolerate CPAP. So, but for a lot of patients, even, 25, 30-year-olds, they have resolution of their, sleep apnea symptoms and they stay on CPAP and they're like, whatever, it's a small price to pay for, waking up feeling refreshed.
Could I interrupt you briefly on the CPAP question?
Yeah, please.
Offline, we were talking about muscle tonality. Sure, CPAP could provide immediate effective solution to sleep disordered breathing. But is it the case, though, that CPAP kind of weakens the muscles over time and can lose its effectiveness over time so that it's more of a short-term solution that can have longer-term negative consequences, or is that bullcrap?
So that's an interesting question. I've had other patients ask me that. I personally have never seen any data to support that. So, I mean, the concept of that is like a ventilator, right? So patients that are on a ventilator, they're intubated, they're not attempting to breathe on their own. So that for sure causes people to decompensate, their diaphragm weakens and other things if you're on a long-term vent. I personally have not seen that, data. I've never seen a long-term study supporting that. So I don't, I understand why people may think that, but, you're wearing it for 7 hours a night and the rest of the day, your muscle tone is your own tone and you're going about the day and you're chewing and you're eating and you're breathing and doing all these other things. So I would personally disagree with that. But again, I think we also just don't have studies to support either way.
Yeah, that's fine. And when you say CPAP is currently the most effective treatment, you're saying that the data does support the notion that a CPAP gives a better improvement in sleep disordered breathing than, even an MMA, for example?
Yeah. So, I mean, I think if you look at all comers, and again, we have to look at patients, not just ones that are of normal weight that have skeletal deficiencies. You have the obese patients, morbidly obese, all these patients. The MMA literature, systematic reviews and meta-analyses say, one that came out a couple of years back was, I think, about an 85% surgical success rate with MMA, meaning their AHI ends up being less than 15 and reduced by at least 50%. And sleep apnea cure was about 34 to 40%, where it's actually less than 5. So that was just kind of the broad data across. And I think, sure, there are plenty of patients that their residual AHIs are a little bit higher, but in general, I see a ton of patients where their residual AHI is 1 or 2. And even with MMAs, you can advance them as far as you want. There's probably still going to be higher residual AHIs. You can take someone from 77 down to 12, and they're asymptomatic. But I think CPAP just kind of blows open the whole airway. So it just indiscriminately holds everything open. So I think, I personally think it's still more effective. The problem is most people don't want to wear it. So, and I think MMA it's a little bit of a Band-Aid, right? It's like insulin for diabetes. You're not curing the sleep apnea. You're just treating it appropriately. Whereas MMA, you're focusing on a one and done. The sleep apnea is no longer there. You don't have to do anything else for it. So there's two different ways to treat it.